Dear audience, it is my pleasure to present you results of my doctoral thesis. The topic of my doctoral thesis is analysis of expression of genes encoding enzymes CYP3A4, CYP2B6 and ABCB1 transporter in patients with HIV and HCV infections treated with antiviral medications. Allow me to start with some background. Human immunodeficiency virus is a retrovirus that primarily targets the human immune system, specifically CD4 T cells, leading to a progressive immunodeficiency syndrome known as AIDS. The pathogenesis of HIV infection involves a series of complex interactions between the virus and the immune system. The progressive depletion of CD4 T cells is a hallmark of HIV infection. The loss of CD4 T cells weakens the immune system, making individuals more susceptible to opportunistic infections and certain malignancies. HIV infection progresses through different stages and clinical manifestations, culminating in the development of full clinical AIDS. Currently, a total of 29 drugs are registered, and they are classified into 6 groups based on their mechanism of action. 2 classes of reverse transcriptase inhibitors have been approved by now. NRTIs, you can see at the slide here, and NRTIs, protease inhibitors as well, PIs, fusion inhibitors, CCR5 receptor antagonist, and integrase strand transfer inhibitors, the last column in this table, or INSTIs. Initiation of combinational antiretroviral therapy is recommended for all individuals with serologically confirmed HIV infection diagnosis regardless of CD4 T cell counts. Similar to HIV, hepatitis C viral infection is a global health problem with over 150 million people being chronically infected worldwide. Hepatitis C viral infection leads to acute hepatitis, but 40 to 80% of affected persons will develop chronic infection. Pegylated interferon with ribavirin has been the standard of care treatment for HCV-infected individuals for decades. However, interferon therapy is complicated by a well-known adverse effect, including influenza-like symptoms, cytopenia, and depression, and the lack of response in some patients as well. In 2011, protease inhibitors such as boceprevir and talaprevir became available. First-generation protease inhibitors had activity against mainly genotype 1, but the most recent inhibitors are extremely potent and they exhibit pangenotypic activity. Unlike with HIV, which causes incurable lifelong chronic infection, HCV-infected patients can be cured with combinational therapy. Because of a common route of transmission, hepatitis C virus co-infection with HIV is frequent. Of the 39 million HIV-infected patients, about 25% are also co-infected with HCV. Co-infection with HIV and HCV has a complex implication for disease progression, treatment outcomes, and overall patient management. The efficacy and safety of applied medication in these chronic infections are profoundly influenced by drug metabolism, which is governed in part by metabolic enzymes and transporters. The quantity and activity of metabolic enzymes and transporters can be different among individuals due to genetic and external factors, such as exposure to different infectious diseases or xenobiotics, which can either suppress or induce the expression of P450 enzymes or inactivate existing enzymes. Both HIV and HCV infection can modulate metabolic enzymes and transporter gene expression levels through complex mechanisms, including viral proteins, inflammatory mediators, and cytokines being some of them. When analyzing the specific population of HIV and HCV patients, some of these enzymes and transporters became more important than the others. In our research, we have conducted analysis of CYP2B6, CYP3A4, and ABCB1 transporter as well. The following research objectives were defined. First, to conduct an analysis of gene expression of CYP2B6, CYP3A4, and ABCB1 transporter in cohorts of patients infected with HIV, patients infected with HCV, and patients co-infected with HIV and HCV. Also, to investigate the association between the degree of fibrosis, level of inflammation, and the expression levels of gene of interest in the same patient population. Then, to examine the potential impact of different therapeutic regimes on the expression of genes encoding CYP2B6, 3A4, and ABCB1 in the same patient populations. And finally, to examine the potential impact of different biochemical and clinical factors on the expression of genes of interest, such as CD4 T cell count, BMI, alcohol usage, smoking, and similar. In order to do that, we have conducted the following methodology. All patients included in this research were divided into 3 main groups. Group 1 included patients more infected with HIV. Second group included patients more infected with HCV, and third group included patients co-infected with HIV and HCV infection. HCV monoinfected patient group were further divided into two subgroups, treated and untreated one. Treated subgroup of HCV patients were analyzed in comparison with treatment that patients were receiving, whether is it pegylated interferon or DAA drugs. This research was multidisciplinary one and multicenter one organized. It was conducted in Belgrade, Serbia and in Liverpool, UK. Patient selections and sample collecting was conducted in Belgrade, molecular analysis was conducted in Liverpool, UK, and histopathological analysis was performed in Belgrade as well at the Institute for Pathology. As you can see on this slide, inclusion criteria were age older than 18, both sexes, male and female, and serologically confirmed diagnosis of HIV and HCV infection. Exclusion criteria were hepatitis of unexplained etiology, autoimmune hepatitis, associated liver disease, use of all known substrates of liver enzyme CYP2B6 and 3A4, and transporter ABCB1. All patients signed informed consent for participation in this study. A liver biopsy was performed as a part of diagnostic and therapeutical protocols in patients for whom it was indicated. After sampling, the liver tissue was divided into two parts. One part was fixed in formalin and underwent further pathological methods to determine the stage of liver fibrosis and grade of liver inflammation. The remaining liver tissue was snap frozen over liquid nitrogen and stored at a temperature of -80 until molecular analysis were performed. Allow me to now present you the main results of this research. In this cross-sectional study, a total of 45 patients were divided into three groups. The sample consisted of 53% of patients with HCV infection, 60% patients with HIV infection, and 27% of patients co-infected with these two infections, as you can see on the panel left and right. In the group of HCV patients, 46% received the therapy and 53% were untreated. Among the treated HCV patients, half of them received pegylated interferon and half of them received DAA drugs. All HIV patients monoinfected as well as patients with HCV co-infection received antiretroviral treatment. In total, 20 patients were treated with lamivudine, 11 were treated with dolutegravir, and 14 were treated with efavirenz used as a part of combination antiretroviral therapy. None of the co-infected patients received treatment for HCV. On this slide, you can see some of the basic patient characteristics. And now let me present you the results about the gene expression, starting with CYP2B6. In a group of patients with HIV, HCV, and HIV-HCV co-infection, over twofold increase in CYP2B6 expression were seen in 35% of untreated HCV patients, 48% of HIV patients, and 81% of these patients who were co-infected, as you can see on the panel left and right. Initial variance analysis revealed a significant difference in CYP2B6 gene expression level across the three patient groups, those with HIV, HCV, and co-infected patients, which we can see as the p-value being 0.017. A more thorough research found a significant difference in expression of CYP2B6 between group of untreated HCV patients and co-infected patients, indicating higher expression in co-infected patients. You can see the p-value being 0.007. Similar to this, our finding revealed a difference in CYP2B6 expression between group of co-infected patients and HIV patients that was significantly different, indicating greater expression again in the group of co-infected patients when compared to HIV patients, with the p-value being 0.013. When analyzed for 2B6 gene expression in a group of HCV monoinfected patients, both treated and untreated, there was no significant difference between groups of treated and untreated HCV patients, monoinfected patients in the expression of genes supporting CYP2B6. But when the comparison was made in between group of treated patients, univariate analysis revealed that the choice of treatment was independently linked with CYP2B6 levels. Specifically, increased expression of CYP2B6 gene was seen in group of patients treated with pegylated interferon compared to a group of patients who were not treated, and also compared to the group of HCV infected patients who were treated with DAA drugs, with the p-value being 0.028, as seen in the table here. This finding may be more clearly seen on the panel right here, where you can see that only 60% of patients receiving DAA, but 80% of patients receiving pegylated interferon both showed an over twofold increase in gene expression for CYP2B6. As for independent correlation of CYP2B6, this is a mistake on the slide. I'm sorry, I apologize. Gene expression, the level of CYP2B6 gene expression showed no significant correlation to the grade of inflammation and the stage of liver fibrosis, nor was a significant difference observed when compared between the group of patients. There was no significant correlation as well of CYP2B6 gene expression values when it was compared with the biochemical parameters, nor with the parameters such as body mass index, alcohol and tobacco consumption. And for the results in gene expression of CYP3A4 in this study population, on this slide you can see a frequency of increased CYP3A4 gene expression in the group of HIV, HCV, and HIV, HCV co-infected patients. And here you can see that there was no significant difference when the comparison was made in between a group of HIV, HCV, and co-infected patients. Also, when the comparison was made in the group of HCV monoinfected patients, there was no significant correlation found in between the treated or untreated patient. There was also no significant correlation found when the comparison was made in between of group of HCV treated patients, whether they were using pegylated interferon or DAA drugs. As for independent correlation of CYP3A4 gene expression, using univariate analysis, we confirmed the correlation of a higher 3A4 expression with the presence of HIV infection, including both groups of co-infected and mono-infected patients. Increased 3A4 gene expression levels were also in positive correlation with the higher grades of liver inflammation, although no correlation was found with the stage of liver fibrosis. As for other potential factors affecting 3A4 gene expression levels, platelet count was found to be significantly higher in patients with higher expression of 3A4, and there was unfortunately no significant correlation between the changes in the level of expression of 3A4 when compared with the other biochemical and clinical parameters analyzed in this study. At the end, for ABCB1 gene expression in this study population, here you can see that there was literally no increased expression of genes encoding ABCB1 in the patients with HCV infection or in the patients with HIV, and only 25% of the co-infected patient had shown an overall twofold increase of genes encoding ABCB1. Initial statistic analysis didn't show any significant correlation between the gene expression levels of ABCB1 when compared in between these three groups of HCV, HIV, and co-infected patients. When the comparison was made in the group of HCV mono-infected patients, both treated and untreated, again, no significant correlation was found. There was also no significant correlation found in the group of treated HCV patients, whether they were using pegylated interferon or DAA drugs. We did find some significant correlations when the independent analysis was, where univariate analysis were performed. There was a borderline significance observed showing lower levels of expression of genes encoding ABCB1 in patients treated with lamivudine in comparison to the levels of expression in patients who were not treated with these drugs. As for the other antiviral drugs used, there was no significant correlation to the expression of ABCB1. There was also no significant correlation found between other group of patients compared in this study or when analyzed for correlation with the stage of liver fibrosis and grade of liver inflammation. Similarly, there was no correlation found when gene expression for ABCB1 transporter were compared with the other parameters that we followed. Initially, when we were analyzing for liver fibrosis, when we were assessing liver fibrosis levels or degree of liver inflammation level, the METAVIR score was used as a measure. And METAVIR score showed no significant difference when compared between groups of HIV and HCV mono-infected patients with co-infected patients. There were also no correlation with the levels of gene expressions for 2B6, 3A4, and ABCB1, and also there was no correlation with clinical parameters. When additional morphometric method was applied, morphometric quantification of CD8 lymphocyte, there was actually a significant correlation with their overall increased expression of ABCB1 gene, as you can see a p-value of 0.035, and as you can see on your panel left, and as you can see on your panel right, how it actually looks like. As for histopathological and morphometric values of liver fibrosis, the stage of liver fibrosis was measured by METAVIR score, and it showed no significant difference when compared between group of HIV and HCV mono-infected with co-infected patients. There was also no correlation with the level of gene expression of 2B6, 3A4, and ABCB1 with the clinical parameters. Again, when additional morphometric measures were applied values of area percentage of fibrous tissue per field of view in liver biopsy samples, they have shown significantly increased values in HCV-infected patients when compared between groups of HIV, HCV, and co-infected patients. There was also a positive correlation between overall values of area percentage of reticulin fibers with the use of alcohol, tobacco, and increased ALT levels for liver enzyme levels, which I will show you on the next slide. Here you can see a correlation of area percentage of fibrous tissue per field of view in liver biopsy sample in a group of HIV, HCV, and co-infected patients. And here you can see a correlation of alcohol and tobacco consumption and ALT levels and area percentage of fibrous tissue per field of view in the group of HIV, HCV, and co-infected patients. And you can see statistically significant p-values on the panel right. As for conclusion, these are the main ones. When examined for difference in gene expression of CYP2B6, CYP3A4, and ABCB1 between group of HIV, HCV, and co-infected patients, there was a significant increase in gene expression of CYP2B6 in the group of co-infected patients. There was also increased expression of 3A4 in all patients infected with HIV, including both mono and co-infected. There was no correlation found between changes in gene expression of CYP2B6, 3A4, and ABCB1 and liver fibrosis between this group of patients. However, there was a positive significant correlation found between increased expression of 3A4 and a higher grade of liver inflammation. There was a significant correlation found between increased expression of CYP3A4 and the use of pegylated interferon in the group of HCV monoinfected patients. There was also a significant correlation found between lamivudine usage and decrease of gene encoding ABCB1. There was a significant correlation found between increased levels of gene expression of 3A4 and high platelet count as well. There was no other significant correlation found between gene expression of CYP2B6, CYP3A4, and ABCB1 and other examined biochemical or clinical factors in this study. This research wouldn't be possible without help from our colleagues from Infectious Disease Clinic and Institute for Pathology, Pharmacology, and for Statistics at the University of Belgrade, also without help from our patients, from our colleagues from Liverpool University and from the Royal Free Hospital in London. And I thank you for your attention.